Mother's Day is traditionally celebrated in Kenya on the last Sunday of June. The free medical camp in Kisii was an appreciation of the hard-working mothers in the region. Due to the much-needed healthcare, even men were not left behind in the experience of receiving free healthcare service organized by MoneyGram International. William Maigo is suffering from asthma, blood pressure and diabetes, and he was informed of a free medical camp. After his registration process to confirm his health identity and location, his blood pressure was measured to verify his health condition at the moment before consultation with a doctor for diagnosis. After treatment, free medication was what he was advised to take, and with a regular checkup at a local hospital. This gate at Kisii Primary School ushered in the young, old and adults that came in large numbers hoping to receive free medical health care.
Nilikuja kutibiwa. Nilikuwa na watoto wagonjwa the whole week. Actually, I was just waiting for a weekend so that I take for medical. So it chanced. Yesterday nikasikia kuna group inakuja for treatment. Nikasema that's the opportunity. Because we just find drugs are expensive, but we've had this free treatment and free drugs given. So I was encouraged. So on my way as I was coming, tukakutana na hiyo gari yenu, your advert, because we were told that it's only mothers who are coming. So I had to stand them to ask, is it real mamas only? Ama pia watoto, because I had my kids. Wakambia hata watoto. So I was dressed. What I did, just took a motorbike, nikafika hapa.
Miguu ndio inanisumbua na mikono na gans. Pia macho naona kama musi. Nimesikia kwa radio. Nimeandikiwa naenda kuchukua madawa.
The push that drove a leading money transfer company, MoneyGram International, to bring healthcare service and to offer free medical camp to benefit a majority of Kisii residents.
Kisii is one of the leading recipient on sending money transfers through MoneyGram in Kenya. So we chose it to boost and to give them back to the society what we've made from them. Today we have a Mother's Day, in fact a Mother's Camp. We are treating children and we are checking and treating children.
Access to quality medical healthcare in Kenya remains a difficult choice for many Kenyans to locate living within their regions. Urban and rural centers all bear the promise of quality healthcare, either at a high cost price to receive treatment and medication. In Kisii County and other regions within Kenya, a better healthcare remains a far cry and greater issue among a majority of residents. Lack of access to medicines in the provincial and general hospitals has proved a huge barrier among residents forced to dip into their pockets to pay or fail to take medication prescribed by their doctors due to lack of finances and poverty. That creates a huge barrier for a majority of residents to take into consideration their healthcare, something that was well documented during the free medical camp.
Hapa Kisii tunasumbuka sana. Na dawa hatuna. General tunaenda tunapanga line hata unakopa kwenda huko. Dawa hakuna. Lakini sasa mwenye alitufikiria kutuletea dawa ya bure hapa. Tunamshukuru sana. Na endelea kutufikiria.
Everything has become expensive. Dawa nini. So I'm grateful to get her free medicine, free checkup for my daughter, and I'm grateful.
After a few hours, the number of patients was enormous that strained a majority of pharmacists giving out medicines and doctors. They, however, managed to effectively tackle every health situation in good time with proper management and consultation.
Since morning, we've been able to see quite a number of patients, most of whom come in with dermatological conditions and upper respiratory tract infections. We've seen a few who have come in with undiagnosed hypertension. We've started them on medication and we've referred them to the nearest facilities where they can afford a follow-up care.
A team of over 33 doctors and clinical officers worked tirelessly to conduct the basic health checks at the medical camp. Each consultation included a general health check as well as screening and treatment of prevalent conditions such as malaria, diarrhea, skin infections, as well as deworming.
For those ones whom we think need a referral in facilities that are not within, we've done that through the XC Level 5 hospital, after which we are confident they'll be followed up and managed. Basically, the camp has been a success because there are some patients who up to date didn't know that they suffer from certain conditions, and we've been able to diagnose those, and we think following this they'll benefit from medical care.
Over 1,300, mostly mothers and children, benefited from the medical camp. A gift hamper issued at the pharmacy after free medication saw an overwhelming expression on their faces as they walked back home after treatment. Serious cases were referred to Level 5 hospital, who were on standby throughout the day. Member of Parliament for Kitutu Chache, Honorable Robert Monda, came for a checkup at the medical camp. Public and private cooperation, according to the MP, is a means to uplift the health of a majority of Kenyans.
Nikiwa mwenyekiti wa afya katika bunge, nataka kusema ya kwamba yale tunahitaji ni kwamba serikali ihakikishe tumeelekea mahali ambapo Wakenya wanapata huduma ya matibabu ikiwa ni ya bure na ikiwa quality health service.
Gratitude towards the free medical camp initiative by the leading money transfer company MoneyGram International that enables customers who are not fully served by traditional financial institutions to meet their financial needs proved a great effort in catering for a majority of the poor in the rural area access to free medical care, treatment and medication.
Nafurahia sana kwa kutupatia dawa, tena nawakaribisha nyote na muendelee hivyo hivyo.
The initiative was held to honor hardworking women and mothers in the region that saw mothers and children receive free general medicine and pediatric treatment service.
Hii program ya medical camp ya siku ya leo ni matibabu ambao imegharamiwa na kampani ya MoneyGram. Nikifikia hapo basi nataka kushukuru sana MoneyGram na wahusika wote ambao wako pamoja nasi hapa siku ya leo, ya kwamba wameona ni heri wacha watusaidie kutibu watu wetu ambao wako na magonjwa mbalimbali siku hii, ili tuwe tumepunguza gharama ya matibabu kwa watu wakati huu.
Medical access is a necessity and the right of every Kenyan. We need to work towards realizing the goal, especially to curb child and maternal mortality.
Nimefurahia kwa kupewa dawa na nitapona.
Sasa ni asante kwa kutuletea dawa. Nimeshukuru sana.
Nimefurahia sana. Nimehudumiwa, tumeambiwa tuchukue madawa na tunashukuru for the project.
The turnout is good. We are targeting around 1,000 and I'm saying we are surpassing the 1,000 mark.
The free medical camp was achieved in cooperation with agent partners, Cooperative Bank of Kenya, Diamond Trust Bank, Equity Bank, Imperial Bank, and Kenya Post Bank for support towards the initiative, and other corporate organizations have been asked to emulate MoneyGram's example, a move said to give healthcare service to those in need.